The fluorescent lights hummed overhead like insects trapped in plastic, casting their pale glow across the pediatric unit of Sacred Heart Hospital in Raleigh. Sarah Chen stood at the medication cart, her hands moving through the routine with the precision of someone who had done this exact sequence 10,000 times, double-checking the names on the bottles, verifying dosages against the electronic chart, her fingers steady as surgical instruments. 3 years. 3 years of night shifts, of keeping her head down, of being the nurse people called when no one else would take the difficult cases. 3 years of staying invisible. She had learned invisibility the way other people learn languages, through immersion and necessity. Her scrubs were always plain. She never wore jewelry except for the small trauma shears clipped to her pocket, their handles worn smooth by years of use, and even those she kept at hip level, unremarkable. Her hair was pulled back in a regulation bun that drew no attention. At 41, she could have passed for anywhere between 35 and 50, depending on the light. That was intentional. Memorable people left traces. Memorable people had records. The night shift culture at Sacred Heart moved like a tide, predictable, methodical, with its own unspoken hierarchy. The day nurses answered to the attending physicians. The attending physicians answered to the department chiefs. The department chiefs answered to the hospital administration. And everyone answered to the donors. Sarah had watched this machinery turn for 3 years, had watched competent nurses pushed into corners because they asked questions, had watched diagnosis-ready patients wait for test results while administrators worried about bed turnover metrics. She knew the weight of it. She had learned not to fight the current. But 3 years of night shifts had also made her invisible in a different way, invisible because she was reliable, because patients survived under her watch, because she caught what others missed. A spike in blood pressure that meant sepsis, not delirium. A subtle change in breathing pattern that caught pneumonia before the fever. A child's cry that signaled pain, not fear. She noticed these things the way a sonar operator hears a submarine's heartbeat through miles of ocean. Most of the other nurses thought she was just lucky. Most of the doctors didn't think about her at all. The medication cart had 7 more doses to verify when the elevator chimed at the end of the corridor. Sarah didn't look up. The elevator meant someone new arriving for the night, another admission, another family crisis, another desperate story. The pediatric unit at Sacred Heart saw its share of those. Childhood illnesses didn't care about business hours. The footsteps came closer, purposeful, not hurried. A man's gait. An older man, if the slight drag of the left foot meant anything. Then came a softer sound, the wheels of a gurney rolling smoothly across the polished floor. Sarah's hands continued their work, but a fraction of her attention shifted. The gurney was child-sized. The man pushing it was tall, broad-shouldered, with the posture of someone accustomed to authority. He wore a Coast Guard windbreaker over civilian clothes, and even from 20 feet away, Sarah could see the weight in his face, the kind of exhaustion that came from having nowhere else to turn. The wheels squeaked once as he stopped at the admission desk. "Commander Mitchell," the night shift charge nurse said, her voice shifting into the gentler register reserved for families in crisis. "We have her room ready in pediatrics. Dr. Hargrove is expecting you." "Thank you." The commander's voice was steady, but Sarah heard the fracture beneath it. "Her name is Emma. She's 7. Sarah kept working, but the medication cart felt suddenly smaller, the walls closer. A 7-year-old in the pediatric unit at 11:58 on a Tuesday night, with a Coast Guard commander pushing the gurney himself instead of letting transport handle it. This wasn't a routine admission. This was desperation. The gurney wheels disappeared down the main corridor, and Sarah heard the muted sounds of the admission process beginning, the soft voice of the admitting clerk, the gentle greeting of nursing staff, the quiet coordination of a hospital preparing for a child who needed help. She had heard these sounds hundreds of times. Usually, they meant something was about to break open in her chest, and she had learned to seal it shut before it could. She went back to the medication cart. The pediatric unit had 8 occupied beds and 4 empty ones. Sarah's territory. Her shift. Her watch. The admission had taken rooms 2 through 4, a suite they reserved for the more complex cases. Sarah could hear movement down there, the muted opening and closing of drawers, the squeak of the blood pressure cuff being located. Dr. Hargrove would arrive soon. He always arrived for the admissions, especially the ones with high profiles or difficult diagnoses. The charge nurse had said his name with the inflection of someone accustomed to taking orders. Sarah finished the medication cart at 12:47 and wheeled it to the locked cabinet. The night shift was measured in small completions. One task finished meant 5 more waiting. She had learned to move between them without thinking, the way a person walks through a familiar house in the dark. Every drawer was where it should be. Every protocol was written in muscle memory. She was heading toward the break room for the first of 2 required coffee breaks when a summons came through her earpiece, calm, professional, the charge nurse's voice requesting her presence in pediatric admission. Sarah changed direction without hesitation. The break room could wait. Admission sometimes meant an extra set of hands, sometimes meant families with questions, sometimes meant catching something the admitting team had missed. Room 2 had a small window in its door. Sarah could see the child before she entered, a girl lying in the hospital bed, her small frame somehow making the mattress seem enormous, her dark hair fanned across the pillow like she had been placed there very carefully. She wasn't crying. That might have been worse. The girl was staring at the ceiling with the fixed, empty expression of someone trying very hard not to feel anything. The commander stood on one side of the bed, his hand resting on his daughter's shoulder. On the other side stood Dr. Marcus Hargrove, the chief of neurology, a man with silver hair and the kind of tailored suit that suggested committee meetings and fundraising dinners. He looked at Emma the way a car dealer looks at a vehicle with transmission problems, clinical, assessing, already calculating whether the investment was worth the effort. "Commander, I've reviewed the preliminary imaging from your facility in San Diego," Dr. Hargrove was saying, his voice carrying the practiced cadence of someone accustomed to delivering difficult news to important people. "The autoimmune response has created significant damage to the thoracic and lumbar regions of the spinal cord. We're looking at long-term paralysis." Sarah watched the commander's hand tighten slightly on Emma's shoulder, just enough pressure to say "I'm here" without using words. The girl's eyes remained fixed on the ceiling. "What are her prospects?" the commander asked. His voice had changed. The fracture underneath it had widened. "Her prospects for recovery are minimal," Dr. Hargrove said, and he said it the way someone might discuss an algorithm, divorced from the fact that he was discussing a 7-year-old child. "Rare autoimmune disorders like hers don't have documented recovery pathways. Our approach will be supportive care and rehabilitation, which may help her adapt to her new baseline," but he paused, and Sarah saw him glance at Emma with something that might have been pity. "We should manage expectations. She'll need a wheelchair. She'll need assistance with daily living activities. Her prognosis is—" He let the sentence die, which was perhaps kinder than finishing it. The commander's hand dropped from Emma's shoulder. Sarah stepped into the room with the medication administration record in her hands, a small thing that gave her purpose, gave her presence. "Emma," she said quietly. "I'm Sarah. I'll be part of your care team tonight. I need to get some baseline vitals if that's all right." She didn't direct the question at the commander or Dr. Hargrove. She directed it at Emma because Emma was the patient, and patients deserved agency even when hospitals stripped away everything else. Emma turned her head slightly, and their eyes met for just a fraction of a second. The girl's eyes were dark and intelligent and completely hollow. They had seen something already that 7-year-olds shouldn't see. Sarah had learned to recognize that hollow look in pediatric patients. It meant they understood, at some level, what the adults were trying to avoid saying. "Okay," Emma said. Her voice was very small. Sarah moved to the vital signs monitor and began attaching the sensors with the careful precision she applied to everything. Temperature, blood pressure, heart rate, oxygen saturation. The monitor began displaying the numbers, each one dropping into the record like data into a file. Emma watched the process with the watchfulness of a creature learning a new environment, trying to figure out which movements were safe. "Dr. Hargrove," Sarah said, her voice even and unremarkable, "has the team considered alternative physical therapy protocols?" Some of the new neuroplasticity research suggests that even with significant spinal damage, early intervention with targeted motor stimulation can sometimes. Nursing protocols focus on patient comfort and safety, Dr. Hargrove interrupted, his tone suggesting he was explaining a concept to someone who might not have the educational background to understand it. Research is my department. Your department is administration. Sarah's hand paused on the pulse oximeter for exactly one breath. She did not change her expression. She did not let the words land in any visible way. She finished attaching the oxygen sensor and stepped back from Emma's bed with the same neutral composure she maintained during every shift. Of course, she said quietly. I'm sorry. I'll document the baseline readings and ensure the care plan is properly communicated to the day shift team. Dr. Hargrove was already moving toward the door, his phone emerging from his jacket pocket, his attention already shifting toward the next task, the next donor call, the next research grant. He didn't look back. The commander was still standing in the same position, staring at the vital signs monitor as if the numbers might rearrange themselves into a better outcome. Sarah moved around the room, completing the other small tasks that admissions required. She verified the 4 placement, checked the monitor settings, ensured the call button was within reach. Emma watched her work, and Sarah worked in a way that made it clear she had nowhere else to be, that this child's needs were the only thing that mattered in the world. It was a lie, of course. The world had plenty of other things that mattered. But Sarah had learned to tell this particular lie with perfect fluency. She was finishing the final task, straightening the blanket, positioning the pillows, when Emma spoke for the second time. Will I ever walk again? The girl's voice was very steady, which was somehow worse than if she had been crying. Sarah stopped. She could feel the commander shift his weight, preparing to answer, preparing to protect his daughter from the answer that everyone in the room already knew. Sarah placed both hands on the edge of the bed and leaned forward slightly, her eyes meeting Emma's with the same directness she had used when greeting her. She did not flinch from the question. She did not offer false hope. She did not treat the girl like a problem to be managed. I don't know yet, Sarah said. But I know that people are often stronger than their doctors think. I know that recovery doesn't always look like doctors predict. And I know that your body might surprise everyone in this room. It wasn't a promise. It was a possibility. Emma's eyes held hers for a long moment. Then the girl nodded once and closed her eyes, exhausted from the simple act of being conscious and brave. Sarah stepped out of the room, her hand steady, her face unchanged. The night shift continued around her, monitors beeping their soft rhythms, the distant sound of a television in another room, the hum of the climate control system that kept the hospital at exactly 68 degrees. She had 4 more hours until the day shift arrived, until the machinery of daylight would take over and she would become invisible again. But standing outside Emma's room, Sarah allowed herself one small acknowledgement of what she had just encountered. A child who needed help. A situation that required more than protocol and standard care. A moment where her particular skills, the one she had learned in places and under circumstances that officially never happened, might actually make a difference. She turned away from the admission suites and headed toward the medication cart, where the night shift was already waiting for its next task. The medication cart wheel squeaked against linoleum as Sarah pushed it through the dimly lit corridor of Sacred Heart's pediatric unit. 2:47 in the morning. The skeleton crew was scattered across 12 beds, most of them sleeping, monitors casting their pale blue glow across small faces. She'd been working nights here for 3 years, staying invisible, doing her job, asking for nothing. That strategy had always worked. Until Emma. The cart stopped outside room 412. Through the partial glass, she could see Commander Mitchell sitting in a chair beside his daughter's bed, Emma's small body barely a ripple under the hospital blanket. The girl's chart had been updated that morning. Dr. Hargrove had written his prognosis in language so final it might as well have been carved in stone: complete paraplegia, permanent, case closed. Sarah was checking the fluids when she heard the footsteps. Heavy. Authoritative. The kind that made nurses look up from their work. Dr. James Hargrove entered room 412 without knocking. Hargrove was 43, handsome in the way that came from old money and better schools, with the kind of presence that made people assume he knew things they didn't. Which he did, in his field. Just not the field that mattered in a room with a terrified child. "Commander," Hargrove said, his voice warm as heated stone. "I wanted to personally walk through Emma's trajectory with you. I know the diagnosis is difficult." Sarah remained at the medication cart, but she was listening. She'd learned to listen to everything. "What's the timeline?" the commander asked. His voice was hollow. A man watching his daughter's future collapse. Hargrove pulled up a chair, crossing his legs with the confidence of someone who had never been wrong about anything important. "Realistically? She'll need a wheelchair by 14. Full-time care by 18. I've seen hundreds of autoimmune cases. The body stops fighting back eventually." He paused, letting that sink in. "I've already consulted with 3 colleagues at Duke. They agree. The next step is palliative care planning." Sarah felt something shift in her chest. Not anger. Anger was too simple. This was the muscle memory of someone who had sat in command posts while men decided other people's fates based on incomplete information. "Is there any chance?" the commander started. "No." Hargrove's interruption was swift, practiced. "Not at this hospital. Not with these resources. Emma's case is medically clear-cut. I understand how that sounds, but false hope is worse than truth." Sarah had taken 3 steps toward the room before she realized she was moving. She paused in the doorway. "Her physical therapy protocol could be modified," Sarah said quietly. "Alternative mobilization techniques. The autoimmune component is responding to the current medication. We could." Hargrove's head turned toward her like a turret finding a target. "Nurse Chen." The way he said her name made it an insult. "Are you suggesting that I, a board-certified neurologist with 47 published papers and a $2.3 million NE grant, should take medical advice from someone with an RN and a high school diploma?" The room held its breath. Emma's monitor beeped its steady rhythm. "I'm suggesting we try," Sarah said, her voice steady as a 4-drip. "Not instead of palliative care. Alongside it." "That," Hargrove said, standing now, "is the problem with nurses like you. You watch a TED talk about neuroplasticity and suddenly you think you understand medicine. You're not a doctor. You will never be a doctor. And while you're playing doctor in this room, you're taking time and resources away from patients who might actually benefit from real treatment." He stepped closer to Sarah, close enough that she could smell his cologne, something expensive, something that cost more than she made in a week. "Emma's case is closed," he continued, his voice dropping to something more lethal than loudness. "Any further mention of alternative protocols will be noted as insubordination. Clear?" Sarah absorbed that the way she'd been trained to absorb shrapnel, without flinching. 1 breath. 2. She looked at Emma, who was watching her with the intensity of a child who understood that something true was happening in her room. Then she looked at the commander. "Clear," she said. Hargrove walked past her, pausing at the threshold. "A nurse? Stick to bedside care. Leave medicine to the physicians." Sarah waited until his footsteps disappeared down the corridor. She finished checking Emma's for without speaking, her hands moving through the motions of her job like a metronome. "Steady. Professional." Emma reached out and touched her sleeve. "Can you really help?" the girl whispered. Sarah turned to meet her eyes. "Try and rest. Your body's fighting hard right now." It wasn't an answer. But Emma understood that the answer was yes. The break room at 3:20 was empty except for Sarah. She'd made the mistake of being hungry. She'd made the worst mistake of sitting at the table with her turkey sandwich and the night's chart notes spread out in front of her. Marcus came in first. Then Jennifer. Then the 2 agency nurses who usually stayed neutral in anything resembling hospital drama. Sarah heard them pause in the doorway. Heard the collective recalibration when they saw her. Oh, Marcus said, the word heavy with the weight of what it wasn't. We were just getting coffee, Jennifer finished, already turning. Be right back. They gathered their lunches from the refrigerator. Every single one. Marcus's lasagna in its plastic container. Jennifer's sad salad in a Tupperware bowl. Even the agency nurse's vending machine purchases. They left without sitting, without speaking, their presence replaced by the fluorescent hum of machines that didn't care who was in the room. Sarah kept eating. She kept reading. She didn't watch them leave. But she also didn't put her sandwich down until the room had been empty for exactly 43 seconds. At 3:51, she pushed through the double doors to the pediatric unit, and that's when she saw it. The unit board. The one where they posted announcements and schedules. There was a new notice in Hargrove's handwriting, copied and laminated and pinned dead center where everyone would see it during shift change. Policy violation notice, unauthorized treatment recommendations. Nurse Sarah Chen, RN, date, current shift. Charge, providing medical advice beyond scope of practice. Recommendation, mandatory retraining on professional boundaries. Status, documented. His name was printed at the bottom with the authority of a seal on an execution order. Sarah stood in front of the board for 8 seconds. She read every word. She took note of the fact that it had been posted while she was in the break room. While she was alone. While witnesses would be harder to find. She took note that he'd spelled her name correctly, which meant he'd done this deliberately, carefully, the way professionals destroyed other professionals. Then she walked to the nearest chart station and began her rounds. At 4:06, Dr. Hargrove arrived for his early morning review. He was walking the hallway near the nurse station with his coffee, black, no sugar, which somehow tracked, when Sarah was updating Emma's chart. She looked up as he passed. She didn't stand. She didn't apologize. She simply looked up, and in that moment, in that particular quality of silence that falls between two people in a hospital corridor at 4 a.m, she spoke. Emma deserves someone who sees her as a patient, not a publication opportunity. The other nurse at the station, Janet, who'd been working pediatrics since before Sarah arrived, looked up sharply. Hargrove's pace slowed. He turned back to face Sarah, and for just a moment, something flickered behind his eyes. Not anger. Uncertainty. The look of a man who'd been seen. I hear there's a visiting physician from Walter Reed on the unit, Sarah continued, her voice soft enough that Janet had to lean forward to hear it. Doing a rotation. Infectious disease specialty. Hargrove didn't respond. He just kept walking. But at 4:37, when the visiting physician, a woman named Dr. Miranda Chavez with the straight posture and calm eyes of someone who'd worked somewhere other than a regular hospital, came to observe the evening rounds, Sarah was checking a pre-op patient in the adjacent bay. The patient had a history of nerve damage. The attending had called for a peripheral nerve block before a routine procedure. Nothing major. Nothing anyone would normally notice. Sarah's hands moved through the process like someone following a map she'd memorized 1,000 years ago. Ultrasound probe. Image the target nerve. Landmark the fascia. The needle went in at exactly the right angle, the right depth, with the kind of precision that comes from having done this in places where your next patient was a 19-year-old from Fort Campbell with a leg wound that might never let him walk again. The local anesthetic flowed. Dr. Chavez, who'd been watching from the doorway, went very still. Sarah didn't look up. She didn't acknowledge the sudden weight of attention, the way Chavez's breathing had changed, the specific quality of silence that comes when someone recognizes something they thought they'd left behind. When Sarah finished, she removed her gloves and turned to document the procedure. She was writing in the chart when Chavez's hand appeared beside her. Not threatening. Just present. A business card placed on the counter. On the back, in careful handwriting, that technique. Helmand Province, 2013. Medevac insertions. I remember this. Sarah pocketed the card without reading her own name on it. She didn't need to. She already knew which name was printed there, the one that had belonged to her, once, in a place that officially never happened. The night stretched on. Emma slept. The commander kept his vigil. And Sarah moved through the darkness of Sacred Heart like a ghost haunting her own life, waiting for the moment when ghosts stop being invisible. On Emma's 14th night in the pediatric unit, Sarah found her seizing. The girl's small body convulsed against the mattress, her lips already blue, her chest motionless. No breath. No air exchange. The monitors screamed their electronic panic, heart rate climbing, oxygen saturation plummeting toward the territory where brains die. Sarah moved. The on-call resident, Dr. Keppel, stood frozen beside the crash cart 3 feet away. His hands trembled as he reached for it. Reached again. Reached a third time, like the cart might suddenly move closer if he believed hard enough. Tension pneumothorax, Sarah said. Not a question. Not a hypothesis. A diagnosis delivered with the certainty of someone who had diagnosed it before while mortar rounds hammered corrugated metal roofs 200 kilometers away. Get the attending, Keppel stammered. No time. She opened the supply tray beside Emma's bed. Her hands found the 14-gauge needle with the precision of muscle memory, the kind that lives deeper than conscious thought, burned into synapses through 1,000 repetitions in conditions that made civilian emergency medicine look like a rehearsal. Her fingers knew that needle the way a sniper's fingers knew their trigger. The way a pilot's hands knew the stick. For seconds. That's what they had. The second intercostal space. Midclavicular line. The anatomical landmarks her body recognized before her mind could calculate them. She didn't hesitate. Didn't ask permission. Didn't glance at Dr. Keppel's stunned expression. The needle went in. The hiss followed, a sound like pressure escaping from a balloon, like a compressed breath finally released. The sound of a pneumothorax giving way, of air that didn't belong in the pleural space suddenly rushing out through a 2-millimeter diameter portal Sarah had just created. Emma gasped. Her small chest expanded. Her lips shifted from blue to a fading gray to something approximating pink. The monitors responded, oxygen saturation climbing in discrete steps like a ladder being climbed by an invisible hand. 72. 78. 84. 90. Stable. The room didn't go quiet. The room went reversed, all the panic suddenly becoming stillness, all the noise collapsing into a single held breath. Sarah's hands were still steady. Her respiration unchanged. She didn't wipe sweat from her forehead or brace herself against the bed frame. She looked at Emma's face, saw consciousness returning to the girl's eyes, saw the moment the child recognized her and mouthed a single word with no sound. Chief. That word. That one impossible word shouldn't have existed in a 7-year-old's vocabulary. Shouldn't have been sitting on Emma's lips in a pediatric unit at Sacred Heart Hospital in Raleigh, North Carolina. But it hung there in the fluorescent light like a confession. Dr. Keppel's stare was incomprehensible. His eyes had gone distant the way eyes go when the brain is processing information that contradicts everything it understands about hierarchy and credentials and who gets to make decisions about life and death in hospitals. A nurse named Patricia, one of the 3 nurses who still made eye contact with Sarah in the break room, appeared in the doorway. Her badge clattered against the frame as she moved. She looked at Emma's revived vital signs. She looked at the needle Sarah had just withdrawn, at the small droplet of air still visible in the syringe. She looked at Sarah's hands, steady and empty now, already reaching for supplies to properly stabilize the decompression they'd initiated. I need a chest tube kit, Sarah said. 18 French if we have it. And get respiratory up here for a portable chest x-ray. The authority in her voice had changed. She heard it herself, the way the timbre had dropped an octave, the way each word had become a command instead of a request. The way her shoulders had unconsciously straightened, her posture shifting from the hunched deference of a night shift nurse into something that looked like command presence. Patricia moved without question. Dr. Keppel finally found his voice. You can't just, you don't have the authority. Emma doesn't care about my credentials right now, Sarah said quietly. Neither do I. The next 15 minutes unfolded with the terrible logic of medicine in motion. Sarah placed the chest tube with the same fluid precision she'd used on the needle decompression, a procedure that belonged in an operating room but couldn't wait for one, so it happened in a pediatric unit while Commander Mitchell stood in the doorway with his hand over his mouth and his daughter breathing again like breathing was the only thing that mattered. Which it was. It was the only thing that mattered. The portable chest X-ray came back at 2:33 a.m. The air had redistributed. The lung was re-expanding. Sarah sat back in the chair beside Emma's bed while the medical monitors settled into their normal rhythm, beeping their reassuring electronic pulses, their vital signs finally consistent with a living child instead of one spiraling toward hypoxic death. Commander Mitchell came into the room at 3:13 a.m. He didn't speak. He just looked at his daughter's face, at the slight rise and fall of her chest, at the girl's eyes tracking the room the way living eyes track rooms instead of staring through ceilings toward something else entirely. Then he looked at Sarah. "I was a medic," he said quietly. 18 years. Before the chair. He gestured to his wheelchair parked outside the door. "I know what I just watched. I know what you did." Sarah met his eyes with the flat composure of someone who had learned long ago that admitting truth required no words. Her hands were folded. Her breathing was normal. She had performed an emergency decompression in a hospital corridor under fluorescent lights while maintaining perfect calm, and now she was sitting in a plastic chair beside a child she'd just saved, and her heart rate was exactly 72 beats per minute. Control. That's what separates the living from the dead. Control and the willingness to act when everyone else is still processing. "She's stable now," Sarah said. "The chest tube will need monitoring. We'll need to watch for output and any signs of infection." "That's not what I was asking." Commander Mitchell rolled closer. His eyes were the color of the Atlantic in November, gray and deep and carrying the weight of understanding. "I was asking where you learned to do that. Because I've trained thousands of sailors in emergency medicine, and I have never seen a civilian nurse move like that. I have never heard someone give medical commands with that kind of authority unless they had worn a uniform doing it." The silence lasted exactly 3 seconds. Then, "I need to check her dressing," Sarah said. She stood. She moved to Emma's chest. She examined the tape holding the chest tube with the focus of someone who had learned to occupy their hands when their mouth wanted to confess things that couldn't be confessed. The girl's skin was warm. The dressing was dry. The world was continuing to rotate on its axis despite the fact that a Coast Guard commander had just asked a direct question to which Sarah Chen had no legal authority to answer. But that wasn't the worst part. The worst part was that Dr. Hargrove was standing in the doorway behind Commander Mitchell, his face a landscape of administrative fury, his phone already in his hand, and Sarah understood in that moment that the man had been trying to destroy her reputation because he'd sensed something. He'd felt the presence of competence that threatened his hierarchical dominance, and he was going to use every institutional weapon available to him to transform that threat into a termination letter. Dr. Hargrove arrived 20 minutes after Emma's oxygen saturation stabilized at 96%. The fluorescent lights above the trauma bay hummed their mechanical drone as he stepped through the double doors, his face a carefully constructed mask of administrative concern that didn't quite hide the calculation underneath. He'd seen exactly what Sarah had done. He'd heard the nurses whispering in the hallway about technique that looked practiced. Surgical. Military. He pulled his phone from his coat pocket before he even checked on his patient, a phone that contained the numbers of 4 board members, 3 major donors, and the hospital's legal counsel on speed dial. The room was still tense. Emma lay sleeping under heated blankets, her small frame rising and falling with the gentle assistance of oxygen. Commander Mitchell stood beside her bed, his hand resting on his daughter's shoulder, and when his eyes met Hargrove's, something flickered there, recognition, maybe, or the beginning of a question he wasn't quite ready to ask. "We'll need to discuss protocol," Hargrove said quietly, his voice carrying the weight of institutional authority. "Emergency procedures require documentation. Chain of command." Sarah didn't look up from the monitor she was adjusting. Her hands moved with absolute precision, checking every setting, every parameter. Her composure was a wall, measured breath, steady fingers, no reaction. She'd known this was coming. The moment the needle had gone in and the air hissed free, she'd known. By morning, Dr. Hargrove had activated his network. It took exactly 14 phone calls. The first went to Richard Thorne, the hospital's chief financial officer and a man who'd made $7 million leveraging Hargrove's referrals to his private practice. The second went to Patricia Holloway, the hospital board chair, whose daughter had received her internship through Hargrove's mentor at Johns Hopkins. The third went to someone at the state medical licensing board. Then came the investigators, 2 of them, arriving by 8 a.m. with tablets and expressions of professional neutrality that suggested they'd already made their conclusions before walking through the doors. They came to Sarah in the break room during her shift. No warning. No privacy. Just 2 men in dark blazers placing a folder on the table in front of her and asking to see her nursing credentials, her educational records, any documentation of her clinical training. The break room smelled like old coffee and the particular staleness of a room where people had eaten their lunch for 30 years without opening a window. One of the investigators had a wedding ring worn through on one side, suggesting he'd been married for a very long time. The other had the flat eyes of someone who'd done this work 1,000 times before. "We're auditing training certifications," the one with the worn ring said. "Routine process. Nothing personal." Sarah opened her locker and retrieved her carefully constructed file. Everything was there, but it wasn't real. The nursing school transcripts were from a program that had closed 15 years ago. The references were phone numbers that no longer existed. The address on her licensure was a postal code from a town where she'd never lived. The Coast Guard had been very thorough when they'd erased her. They'd given her a whole false history, complete and airtight. For a civilian hospital in Raleigh. What they hadn't counted on was that the investigators would also call the numbers themselves. That they'd press past the voicemail systems. That one of them would know the signature pattern of federal misdirection when they heard it. By 2 p.m., Hargrove had what he needed. He called a press release, not to the media, but to the hospital board. Sarah had violated patient privacy by performing procedures outside her scope. She'd endangered a child. She'd falsified credentials. The evidence was circumstantial, but the pattern was clear: deception. Danger. Liability. He recommended immediate termination and notification of the state nursing board. He recommended that Sacred Heart's legal team consider whether they had grounds for prosecution. It was brilliant work, really. It was the kind of institutional assassination that required no actual proof, only the appearance of concern. Only the authority of a man who'd spent 20 years building relationships with the right people in administration. Sarah didn't fight it. When the hospital director called her into his office at 4:22 p.m., she sat in a chair upholstered in grey fabric that felt like sitting on institutional indifference. He didn't meet her eyes. He slid a termination letter across a desk that cost more than her car. "I'm sorry," he said, and he sounded like he meant it. But the board's recommendation was unanimous. She picked up the letter. 47 words explaining that her employment was terminated effective immediately for violation of nursing scope of practice, falsification of credentials, and endangering patient safety. It wasn't a request. It was a command. She removed her badge from her lanyard, the plastic ID that had been her entire identity for 3 years, and placed it on the desk beside the termination letter. Then she walked to her locker and cleared it in under 5 minutes. Everything fit into a cardboard box, a change of clothes, 3 photographs she'd allowed herself, a pair of combat boots at the bottom she'd hidden under a rolled-up towel, and a faded unit patch sewn into the lining of an old jacket. The patch showed a compass rose and an anchor, the Maritime Security Response Team insignia, the unit that officially never existed. She didn't cry in the hospital. She didn't cry in the car. She made it all the way home to the small house on Dogwood Lane before the weight of it finally hit her. It was raining when she sat down at the kitchen table. Rain hammered the windows like someone demanding entry. The kind of rain that comes in sheets, relentless, soaking into the pavement and pooling in places that should have been dry. The house was quiet except for the sound of water and wind. The walls felt like they were pressing in, the same walls that had been pressing in for 3 years, in every safe house, every borrowed identity, every life that wasn't really hers. She had $847 in her checking account. No references she could actually call. No previous employment she could explain. No identity that would hold up to 30 seconds of investigation. The government had taken everything that made her real and replaced it with scaffolding made of lies. The cardboard box sat on the table. Her termination letter sat next to it. And underneath everything else in the box, her hands found the jacket with the faded unit patch. She pulled it out slowly and stared at the compass rose, a symbol that meant she knew how to find north in the dark. That she'd found her way through worse than this. For a moment, her hand shook. Not with fear. With something else, the knowledge that she'd survived gunfire and ambushes and 17 hours of rescue operations in terrain where the temperature dropped below freezing at night. She'd pulled 3 CIA contractors out of a burning helicopter while ground fire peppered the aircraft with rounds that sounded like hail. She'd held a man's organs in her hands while running through Helmand province toward a medevac that might not arrive in time. And she'd lost it all because she'd tried to save a child who the system had already discarded. She held the jacket for a very long time. Long enough for the rain to ease into a steady drumming rather than an assault. Long enough to feel the weight of 37 years of training concentrated in one piece of faded canvas. One tear escaped, just one, and she wiped it away without any change in her expression. That was the training too. Soldiers don't break. They don't cry. They don't sit at kitchen tables in Raleigh, North Carolina, wondering if they've already failed. Her son came home at 6:13 p.m. He was 10 years old, and he had her eyes but his father's certainty that the world made sense if you just tried hard enough. He stopped in the doorway to the kitchen and looked at her sitting at the table with the cardboard box and the jacket and the termination letter spread in front of her like evidence of a crime. "Mom." His voice was small, uncertain. "Why are you home early?" She looked at her son and felt the full weight of what she'd just lost. Not the job. Not the identity. But the one place where she'd been doing something that mattered. The one place where she'd actually saved a life instead of just surviving. "We might need to move again," she said, and it cost her everything not to look away. "I'm sorry, sweetheart." "Again?" His voice cracked on the word. They'd moved 7 times in his life. 7 cities. 7 new schools. 7 fresh starts that felt less like beginnings and more like evacuations. Where? She didn't have an answer. The phone was silent. No government handlers were calling with new cover identities. No safe houses were being prepared. There was only the rain and the cardboard box and the knowledge that she'd made herself visible to the wrong person, and now she had nothing. And then, beneath the sound of the rain, beneath the sound of her son's breathing and her own heartbeat, something else cut through the darkness. A distant sound at first, so faint it might have been imaginary. Then louder. Closer. The unmistakable thud of rotors against the heavy night air. The helicopter rotors drummed against the night sky above Sacred Heart, getting closer. Sarah stood at the kitchen sink with her phone dark, her hand submerged in cold dishwater, when the sound made her freeze. 3 years of perfect anonymity. 3 years of being nobody. 3 years dissolving in rotor wash. The rotors settled on the hospital's landing pad 2 miles away. She didn't move. Her 10-year-old son was asleep upstairs. The termination letter sat on the counter, hospital seal official and final. She pulled her hands from the water and pressed them against her eyes. The phone rang at 2:13 a.m. Unknown number. She answered. Senior Chief Chen. A woman's voice, military cadence. "This is Admiral Reeves, Operations Command. We have a situation. You're needed. Now." Sarah's voice came out steady. "I'm no longer active. Your records say otherwise. Helicopters on the pad. You have 4 minutes." The phone went silent. Sarah stood in her kitchen wearing borrowed clothes and someone else's name, every cell of her body remembering what it meant to be called by her rank. She looked upstairs at her son's closed door. She looked at the termination letter. She moved. The hospital board was convening in the executive conference room when the helicopter touched down. Dr. Hargrove stood at the polished table presenting his case, his hands gesturing at files he'd compiled, the outside investigator's report, the credential audit, the witnesses who'd verified Sarah's fraudulent background. The hospital administrator sat pale and quiet, trapped between Hargrove's institutional power and the weight of what he'd discovered. Two board members exchanged glances. Hargrove was in his element. He'd activated his entire network. Called in favors from 3 county officials. Had someone at the state licensing board personally confirmed the nurse's credentials were fabricated. This was power deployed precisely. The conference room door opened without a knock. Commander Mitchell wheeled himself through, and Emma sat upright in his lap, her small hand gripping his uniform collar. The girl's eyes moved straight to Sarah, who stood behind the security officer in the doorway, still wearing the scrubs she'd changed into in the car. Emma insisted on attending, Mitchell said. His voice was flat. Command tone. Dr. Hargrove stood. Sir, this is a personnel matter. Emma shouldn't. The girl reached down and touched her father's uniform jacket. Her fingers found the faded patch sewn into the lining, the Maritime Security Response Team insignia, the same insignia Sarah had worn for 12 years. Emma's small voice cut through the room's silence. Senior Chief. The room went still. The fluorescent panels hummed their mechanical drone. No one moved. Mitchell stood from his wheelchair for the first time anyone in the room had seen, his leg supporting his weight, his hand on his daughter's shoulder. He looked directly at Sarah. The hospital administrator's hands trembled as he opened the folder in front of him. His voice dropped to something smaller than conversation. 2 Navy crosses. He stopped, let it land. Silver Star. Another pause. Longer. 7 combat deployments. Helmand Province, 2009 through 2016. A man in a charcoal suit stood quietly in the back corner of the conference room. Nobody had noticed him until now. His shoulders carried the particular way a body carries weight after 30 years of discipline. When he spoke, his voice was the kind that made other voices stop. Bronze Star. He named it like a prayer. Silver Star. Like a command. Navy Cross. Navy Cross. 3 Purple Hearts. Dr. Hargrove opened his mouth. Nothing came out. His face had gone the color of old paper. The same security guard who'd escorted Sarah from the building 3 days earlier walked forward and placed a cardboard box on the conference table directly in front of Hargrove. The box contained a single manila envelope, sealed. The guard's voice was quiet. I believe you know the way out. Hargrove's hands shook as he reached for the box. His face cycled through colors, red to white to something worse. He tried to speak twice. Both times, nothing emerged except a sound like wind through a broken window. The board members had turned away from him. The administrator stared at his folded hands. Mitchell hadn't moved. Emma kept her small hand on her father's uniform patch. Sarah didn't move either. Her breathing was measured, controlled, the breath of someone who'd held lives together under pressure. Her eyes tracked Hargrove's retreat to the door. His footsteps echoed down the empty corridor. The security guard followed him, making sure he reached the parking lot, making sure he understood the permanence of departure. The administrator's voice came back into the room, measured now, official. Dr. Hargrove's employment is terminated effective immediately pending investigation into gross negligence and dereliction of duty. The hospital board apologizes. More than that. Sarah. Emma's voice. Will you help me walk? Sarah crossed the room. The girl's legs wouldn't carry her yet. Wouldn't for weeks. But Sarah placed her hands on Emma's shoulders anyway, her touch the kind that came from having held 1,000 bodies through transitions they didn't believe were possible. We're going to do better than that, kid. The administrator was already speaking into his phone, already calling the board's legal counsel, already beginning the process of documenting Hargrove's misconduct. The SEAL officer, Commander Jackson, it turned out, from JSOC, had moved to the window overlooking the parking lot where federal agents were already approaching Hargrove's car, badges visible, voices official and final. 3 months later, Dr. Hargrove was teaching CPR certification courses at a strip mall urgent care clinic in Tucson for $18 per hour. The name tag read Steve. He flinched when anyone called him doctor. His medical license hung in suspension, then revocation. The investigation had uncovered 3 other patients he'd dismissed as hopeless cases. 2 of them had sued. 1 was recovering. The 3rd was applying to other hospitals for care. Sarah Chen, Senior Chief Petty Officer, sat in the Director's Office of Sacred Heart Hospital's newly opened Emergency Medicine Wing, a wing dedicated to combat veteran care, created with the funding that had previously gone to Hargrove's research grants. The hospital had reformed. A dedicated trauma team. Pro bono care for veterans. Specialists who understood what the quiet ones could do. She was still in scrubs though. Still checking vitals at 2 a.m. when the ward was quiet. Still sitting with patients nobody else wanted to sit with. The director's title looked fine on paper. But her fight was here, in the rooms where people were breaking, where hands that had held 1,000 lives together could make the difference between giving up and trying one more time. Emma stood with a physical therapist now, her legs shaky beneath her, her father's hand steady on her back. The progress had been 3 steps per week for months. Now she was managing the length of the therapy room. Sarah watched from the doorway, not speaking, just present. That was the real work. The presence. The belief that bodies remember what they're supposed to do if someone keeps showing up to remind them. Commander Mitchell saw her and nodded. Just that. Just the acknowledgement between 2 people who understood the cost of service, the weight of impossible choices, the way you keep moving even when the world tells you to stop. That evening, sitting in the hospital's physician lounge, a nurse Sarah had trained 3 months earlier offered her coffee. Their eyes met for just a second, long enough for respect to move between them. Long enough for Sarah to understand that her presence had changed something in the culture. That people were watching how the quiet woman in scrubs treated patients nobody else believed in. That they were learning something about what competence actually looked like when it wasn't decorated with arrogance. The trembling wasn't fear. It was restraint. Years of it. The ability to hold power without displaying it, to save lives without needing credit, to walk into a room and have people stand because they understood who she was, not because of a title or a rank, but because they'd watched her work. Because they'd seen her hands. Because they'd witnessed what one person willing to risk everything could do for another. She didn't need the uniform anymore. The work was enough. The patients were enough. The knowledge that a child who'd been declared hopeless was now learning to walk, was now learning to believe that her body might be more than what it had been told to accept, that was the decoration. That was the medal. Heroes walk among us. Sometimes in scrub saving lives in the dark. If you've ever been underestimated by someone with power, if you've ever doubted whether the quiet person in the room might be the strongest one there, like this video. Subscribe. And tell me, would you have saved her, or would you have protected your career?